Agfa Healthcare presents solutions at the world of health IT, capable of networking the patient data of hospitals across an entire region. Agfa Healthcare believes that the synergy of imaging, clinical knowledge and information technology will create a unique momentum for healthcare professionals to improve efficiency and safety of care delivery to patients.
More and more we see the necessity for intersectoral communication, but also inter-hospital communication. And one key offering within our portfolio, which is displayed during this conference, is a product range called Impax Data Center, IDC, which allows different hospitals to send patient data, image data, DICOM data, non-DICOM data, and access it across different sites.
This accelerates the exchange of information between physicians, benefits patients by cutting waiting times, and also helps to reduce costs as a result.
One example, for instance, a very interesting clinical use case is that a physician could start to work on a dedicated clinical case, start the diagnosis, start work on the report, and then transfer this particular case to another site, another clinic, or ask for a second opinion.
Impax Data Center is able to access the data of existing systems. This also enables larger networks to be created quickly and easily.
Let me give you the latest example of Denmark, Hovedstaden, the region of Hovedstaden or Copenhagen, where we have been awarded also with the deployment of Impax Data Center in the whole region around Copenhagen. You have to imagine that those, I think, 12 to 13 facilities have existing hardware server infrastructure in their basement, in their IT departments. But the data that sits on those different devices is not interconnected across the different hospitals. So what Impax Data Center does, it basically adds a middleware layer on top of the existing IT infrastructure. It turns all the different components into a single cloud from a Web 2.0 perspective. So every physician now, with the access rights, can access images and clinical patient from all the different hospitals. And if you're, as a patient, go from one hospital in Copenhagen to another hospital in Copenhagen, all treating physicians in that network can access your data throughout the network. And this clearly helps you from a physician, or helps you from a patient point of view. It brings a lot of comfort to the physician. It brings down the number of unnecessary in vivo imaging procedures. So if there is a 2-3 weeks CT study available in another hospital, but you need it, then you don't need to take it again. So there's clearly some qualitative and financial benefits to it.
The rapid exchange of data means patients no longer have to spend anywhere near as much time in hospital.
With all physicians having access to all clinical image data, both DICOM, non-DICOM image data, the inpatient stay for a dedicated patient can be reduced by, I would say, a minimum of half a day, and in some cases even by 2 to 3 days, especially for chronic diseases and complex diseases. We've seen some cases where the inpatient stay period could be reduced from 12 days from a very complex procedure to even 8 to 9 days, and that's really impressive. Yeah.
Regional networking based on the Impax Data Center optimizes processes in hospitals, helps to reduce costs, and ultimately means that patients receive better care.
We'll take you there really underlines the core strength of Agfa. We don't give up on complex projects.